Hi everyone, welcome to the Bidders Conference for the Evidence-Based and Evidence-Informed Home Visiting Programs for Prenatal to 5 Services with Best Starts for Kids. We want to thank you so much for taking time to join us this early morning, late afternoon. I'm Melanie Moultrie. I'm the Home-Based Services Manager with Best Starts for Kids. And I'll also be joined in this presentation by my colleague, Sarah Jane Sanford, who works with the evaluation team, and also by Chris Diabro from the contracts team, who will be able to answer any contract-specific questions. So we have about an hour and 15 minutes together, and during this time, we will, one, provide a very brief overview of Best Starts for Kids, review the key elements of the request for proposal, and also have a brief question and answer period. I do want to let you know that you should feel free throughout the course of the presentation to enter any questions into the chat box that you have. We will go ahead and read those questions at the end of the presentation and provide an answer to you. In addition to that, you can also save your question and we will unmute all of the audience members, and then you can also just raise it in person at that time. Do feel free to follow along in the RFP, either electronically or a hard copy of the RFP, as the presentation directly corresponds with it. So we'll just start by providing a brief overview of Best Starts for Kids. And the vision of Best Starts for Kids is that we want to see more babies born healthy, more kids thrive, and more young people grow up to be happy, healthy, and successful adults. And all of BSK is framed by an equity and social justice lens. So what does that mean? Best Starts for Kids recognizes that persistent inequities exist, especially by race and by place, and that in many cases, things are getting worse and threatening the collective prosperity of families in our city and our county. Partners are working to invest in organizations that are reflective of and embedded in the communities they serve, and those that recognize and address the disparities and disproportionalities that exist in our communities. So a little bit more about the sort of framework or strategy for Best Starts for Kids. So the overall approach is to increase the good, to decrease the bad, and to intervene when needed. And to do that, we use this framework: promotion, prevention, early intervention, and policy and systems change. Promotion begins before birth and it extends throughout life. And that simply means that we are increasing positive resources, relationships, opportunities, and environments available. For prevention, we are working to prevent things like stress, like unsafe environments or insufficient opportunities. And when challenges do arise, we are supporting early intervention, and that means intervening as early as possible. In addition to that, of course, Best Starts for Kids is also working for policy and system change, so that is creating an environment that supports promotion, prevention, early intervention, as well as broad-scale community change. So the Best Starts for Kids structure, which you see here, was developed through intensive community engagement process involving over 2,000 community members directly. Best Starts for Kids will invest an average of $65 million per year, and we will engage in the following 4 strategies here. So 50% of funds go to investing early, 35% to sustaining the gain, 5% to data and evaluation, and 10% to healthy communities. As you might imagine, the home-based services RFP that we are reviewing in this conference lives in the investing early bucket. So now that we've done a brief review of BSK, let's move into the specific RFP. So this particular RFP is being administered through the home-based services strategy area, and it is specifically for home visiting services. And I do want to call your attention to this because home-based services is a very specific type of home visiting is a very specific type of home-based service. So home visiting programs are regular. That means a home visitor is in the home on a regular basis, whether weekly, biweekly, or monthly. That family can expect that a home visitor will be there. They are sustained, so services last between 9 months and 5 years. They're relationship-based, so change results from the interaction between the home visitor and the parent caregiver, and the parent caregiver and the child, and they're also standardized. And so that means that home visiting services follow written guidelines and/or curriculum that specify how the program should be delivered. And each of these characteristics is required for this RFP in order to be eligible. So while this RFP is focused on evidence-based and evidence-informed practices, we also wanted to provide a framework for the larger home-based services approach, which values multiple types of evidence. So as many of you know and have likely experienced implementing programs in our community, the field of home visiting has been heavily influenced by evidence-based practice. And we know that evidence is important, and we want to invest in what works. And at the same time, we also know that often evidence-based programs have not been tested in diverse communities and are not designed to reach and serve specific community needs. So in line with that, we really want to acknowledge other forms of evidence in addition to traditional evidence-based practice, and those include things like community-defined evidence and practice-based evidence. So community-defined evidence refers to practices that communities have used and have determined yield positive results, and practice-based evidence refers to local aggregate data collected by individual client in the context of individual client stories to learn what is happening in the community. So in line with the equity and social justice framework that shapes BSK, we think it's important to acknowledge multiple forms of evidence. Thank you. And so in line with that, we want to note that we'll be investing in three categories, and that includes evidence-based programs, evidence-informed programs, and also community-informed programs and practices. I'll also quickly note that we have made investments in nurse-family partnership and parent-child home program outside of these two RFP processes. So while we will have two RFPs, this particular RFP is for evidence-based programs and evidence-informed programs. A separate RFP for about $2.5 million will be released in late January for our community-informed programs and practices. So for the evidence-based and evidence-informed RFP, let's first quickly review eligibility. So the first area of eligibility is organization types. This is open to not-for-profit organizations, community-based organizations, tribes and tribal organizations, schools and school districts, and public or governmental agencies serving King County. And we very much encourage small nonprofits and community-based organizations to submit proposals. This funding opportunity is also open to organizations that have been implementing home-based services for some length of time, but also to startups. So if you want to start a new program in home visiting but have not yet been able to have the opportunity to do so, you are still eligible for this RFP. And finally, just want to note here that there are two ineligible home visiting models, and those are parent-child home program and nurse-family partnership. And again, that's because we have invested in those particular models in other, outside of these particular funding opportunities. The investment available for the evidence-based and evidence-informed RFP is as follows. Evidence-based programs will be investing in about $1.25 million in base funds and $130,000 in startup funds. We'll talk about what that means on the next slide. For evidence-informed, it's the same amount. There will be $1.25 million available and $130,000 for startup expansion funds. And we do want to be really clear that we reserve the right to reallocate funds between those two funding categories based on the applications that we receive. So of the investment available, let's talk about these two terms, base funds and startup funds. Base funds are dollars for community organizations to implement a core set of home-based services for children and families. These are the annual dollars to operate your program that you need every year. Those will be renewable for up to 2 additional years should you be awarded funds. Then there's also additional funds available for what we're calling startup or expansion funds. And those basically provide dollars to community organizations to acquire resources and build infrastructure to implement a new program or to expand an already existing one. These will be issued one time, and those are not renewable. So a couple of examples here are provided both in the RFP and on the slide. These will include things like program-specific costs, so affiliate fees for a national model, the purchase of additional materials such as training manuals. Under the information technology bucket, we're looking at costs associated with hardware. So for example, if you need tablets for your home visitors out in the field, software, so data systems. And also we've made leadership personnel an allowable expense for startup and expansion programs, knowing that it can often take a significant amount of program manager, program director, executive director time to really get a program off the ground. Okay. So let's dive into the criteria for each of these different buckets. So the first one is evidence-based programs. And again, there's $1.25 million available in base funds and $130,000 in startup. The contract period will be January 1 to December 31, 2018. Again, that will be renewable for an additional 2-year contract, and then we will re-RFP those funds again after that. For model eligibility criteria, there are two categories to pay attention to. The first is program characteristics, and the second is research and evaluation characteristics. For program characteristics, we're looking for organizations to apply for models that have a theory of change, and the theory of change has to connect services to outcomes. The program should have a formal manual or training guide that specifies the core elements or core components of the model. It must appear in a national registry, and we've hyperlinked some of those national registries for you. And then crucially, it must also meet the definition of home visiting that we already reviewed in this presentation, and that is outlined in Section 2A of the request for proposals. With regard to the research and evaluation characteristics, to be eligible for the evidence-based funding category, the model itself must have two randomized controlled trials, and that program must also have a sustained effect at least 6 months beyond the end of treatment. So those are the requirements for evidence-based practice. Some example models that are currently operating in King County include child-parent psychotherapy, parents as teachers, early Head Start home-based, and family spirit. There are numerous other models that are characterized as evidence-based practices that would certainly be eligible as long as they meet the other criteria outlined in the RFP. With regard to the funding request limits, the minimum we ask you to request is $150,000, and the maximum is $250,000, plus up to an additional $25,000 in startup or expansion funds. And for this funding category, we anticipate between 5 and 8 awards. For the evidence-informed programs, let's take a walk through the criteria here. So again, the funds available are 1.25 million plus 130,000 in startup or expansion funds. The contract period will be the same, 1 year plus an additional 2-year contract based on performance and continued accessibility of funds. The model eligibility criteria, of course, is different. So let's quickly walk through the program characteristics. So for an evidence-informed model, it must also have a theory of change. It must have documented guidance. So while the evidence-based practice required a formal manual and training, the requirement here is simply documented guidance that specifies core activities that should take place in the program. And again, it must meet that definition outlined in Section 2A of the RFP. Some example models for this particular funding category include the community-based doula model, the parent-child assistance program, steps to effective, enjoyable parenting, again, among others. Those are a list of programs that we're aware of operating in King County. Funding request limits are the same, $150,000 for the floor, $250,000 for the ceiling, and up to $25,000 in startup expansion funds. And again, we anticipate between 5 and 8 awards. So many of you may have questions about where your home visiting model best fits. So we find that this table is useful to sort of help assess where you're at. But there are other resources to help you determine that, and we wanted to share some of those with you. I think first and foremost, if you are either a new or expansion program, you want to reach out to the model developer. Often the model developer will have an expert in research and evaluation who can very quickly tell you which category to apply under. You have access to technical assistance, which we'll review a bit later in the webinar. And if you still do not know exactly where your model fits, you can select I do not know in the application, and we will, based on the materials, the information you provide in your application, determine which category it fits best into. I do want to stress that you only want to select that if you know it meets at least a minimum requirement, because we don't want you to spend time developing an application and then find out you're not even eligible for the evidence-informed category. One additional point that's worth noting here is that you cannot apply with the same model, so one model under both buckets, because of course if you have a model that meets the criteria for evidence-based, it also meets the evidence-informed criteria. So if it does meet that evidence-based practice criteria, that's the single bucket you should be applying for funds in. Okay. There are 3 funding priorities, these directly aligned with BSK's Equity and Social Justice Framework. And that is that we will invest in communities of color, low-income communities, limited English-speaking communities, and that we are asking you to make a case for disparities and disproportionalities faced by these communities in the application itself. And we have provided resources for that, as well as definitions in the glossary of the RFP. We are also investing in populations and communities that are experiencing significant service gaps. And of course, this can look a couple different ways. And that could be that there are few or no services available for that focused community, that services are available, but they are insufficient for the need that may be faced by that community, and that services are not relevant and tailored to specific community needs. Finally, we are prioritizing investments in organizations that are connected to and embedded in the community. And that means that they employ staff and leadership that are representative of the community served, and that they have regular methods for seeking input from communities about the quality of services, satisfaction with services, and ongoing needs with the community. So with that, I'm going to hand it over to Sarah, who is going to walk us through the data and evaluation section.
Thanks, Melanie. I'm going to start just by sharing some guiding principles that our data and evaluation team uses and that you can expect in your experience in applying and potentially contracting with us. Those principles are partnership, collaboration, and accessibility. So we really want to work together to make sure that you have the data resources that you need and that our evaluation plans are really mutual products. So I'm going to start by talking a little bit about using data in your application and then briefly cover what you can expect and what you need to know about evaluation at this stage of the proposal. So next slide. So looking at your application, we really encourage you to start by thinking about what's the story that you can tell about your proposal that will help make it compelling to funders. And then after you've identified that story, think about what kind of data will be helpful to you. And I'll talk a little bit more about some resources. But we really think it's most effective use of your time if you start with the story. And for this RFP, all of the funding is going out for home visiting. We all know that home visiting can be hugely impactful for children and families. So the story maybe isn't just about home visiting, but about why you're excited about the model that you want to use, why you're serving the community that you serve geographically or culturally, or your own organization's capacity to do a great job impacting families. So once you've thought through what story you can tell about your work, then it's time to think about what kind of data will help support that story. And in the RFP, you'll find some different sources of information, but we really want to set the stage by encouraging you to think broadly about data. We're putting some data out there just to help you find it. It doesn't mean that's the only data that we're interested in or want to see. So you might have numbers and stories from your own organization's work that will be helpful in showing the value that you can bring to kids and families. So we're not just talking about numbers, although that can be really helpful. But here we have an example of a quote from a program's client saying how big a difference their services made for her family. And that can be a really important part of telling your story too. And we really are open to a wide range of different kinds of data in your application. So we have put some resources into the RFP. And these are really meant to help you most easily find the data that you might want. They're not meant to limit you at all, but I want to take a moment and introduce you to some of those resources so that you can navigate them a little bit more easily when you get down to writing your application. So we have different kinds of data included in there. There's demographic data that can help describe the communities that you're serving, as well as needs data. So if we click on this example needs data, it's going to open up a visualization. And I think that these visualizations offer a lot of really cool information that can help you find really targeted information about your work and the communities that you work with. But if you have never seen them before, it helps to just be a little bit familiar with how you can use them. So what you see here opens up onto a map. And if you hover over some of the areas, they're all different cities, neighborhoods, and regions in King County, it will tell you information specific to that area. So right now we're looking at Newcastle. We see that 69.9% of moms in Newcastle received early and adequate prenatal care, which isn't significantly different from King County. But if you look around, you will see that there are other regions of King County that moms were less likely to get early and adequate prenatal care. So that's an example of some of the geographic information that's available. If we scroll up a little bit here, you'll see some tabs along the top. And if we go ahead and click on demographics, that will help you break down information by, it's a little bit different for every indicator depending on the source of the data, but we try to put as much information out here as we can. So we've got mother's age, mother's education level, mother's race and ethnicity, and then the region and the neighborhood in King County. So if you're serving a specific population, a specific region, this should help you find, the most specific information to the community that you want to serve. If we click on the Trends tab, you can see a little bit more about how, in this case of this indicator, access to prenatal care has changed a little bit over time. And often the trends are broken down either by region or race and ethnicity as well. So you can see both how it's changed over time and how those disparities in access have changed over time as well. And then scrolling again up to the top, the last tab I want to show you is custom demographics. And this one can be a little bit overwhelming, but it also can be really cool, again, if you're looking for really specific groups. So let's say that you would like to compare all of mother's race, ethnicity, and then region in the second box. This is going to break it down for you. So if you are wanting to serve a specific race and ethnicity, you can see where the disparities they might be experiencing are in different parts of King County. And you can do that for a lot of different demographic factors. So there's a lot of information in there. It's a cool tool, I think, to help get really good specific information about the communities that you're serving. And hopefully now that you've clicked around in it a little with us today, you'll be able to find the information that you want if you do choose to use these data sources. So going back to the PowerPoint, a few more things that I really want to highlight. Again, is that we do value hearing lots of different kinds of data, including stories, and the resources there are meant to save you time and help you find some stats that might be relevant to you, but they're not meant to dictate what you should use to make your case, or the only kinds of data that we want to see. One of the links in there that you'll find is to a map of home-based services in King County, which shows all of the home-based services that we know about right now, but it may not be comprehensive. So definitely feel free to share any additional information that you have about home-based programs available in your community. So I think we've got one last slide. I'll talk more about evaluation. Or sorry, two more on evaluation. You'll see in the RFP, including an opportunity for you to make some selections, information about indicators. What are we talking about when we use that word? These are a set of population-based measures that we at BSK are tracking for all of King County. And there's a lot of different programs, a lot of complex contextual factors that impact these indicators. So we're not looking for any one program or project to be able to change, everything about healthy children in King County. But we do want to keep our eye on that big picture and see if collectively the work that we're doing is moving the needle on these big maternal and child health items. So I've included the link here where you can check it out. Most of these indicators have visualizations like the one that we looked at if you're curious to learn more about them. But on the RFP, you will be asked to select which ones you think are relevant for your proposed program and your proposed model. You don't have to check them all. In fact, it makes a little bit more sense to be selective and show what your program really excels at. But it is something we're thinking about with all the BSK RFPs, is that we have these collective big goals that we're working on, and we want to be really transparent about that. And then a few more things to know for evaluation. All programs will be required to participate in our evaluation efforts, but you're not required to have a plan at the proposal stage. If you are awarded funding, the BSK team will partner with your organization to develop that plan. As I mentioned, not all programs will be relevant for all indicators, so we want to focus on ones that you feel that your model has the biggest contribution towards changing. And then finally, where possible, BSK will attempt to coordinate and collaborate with other home visiting data collection. So as much as we can, we want to be able to streamline things, use data that you might already or otherwise be collecting, and not duplicate those efforts, so that we can, just makes the most sense to use the information available to us and not create extra work. So that is something that we are aware of. Evaluation can be a heavy lift for program staff, and we want to make it smooth and workable for the grantees that we partner with on the home-based services. So we look forward to answering more of your questions, but I'm going to hand it back to Melanie for more information about the RFP.
Thank you, Sarah. So in addition to evaluation, if you have the opportunity to receive a BSK Home-Based Services Award, there will be a number of other contractor requirements associated with that, and we wanted to be, of course, clear and upfront about what those would be. So first would be completion of a capacity assessment and implementation plan. So should you receive an award, we would ask you to participate in both of those activities, and those would inform both your contract as well as potentially any technical assistance that you might receive. We would also ask that you participate in up to 3 BSK home-based services annual events. And those will provide orientation to BSK, but we'll also focus on other areas such as professional development, data use, and systems building. And finally, as part of the BSK strategy, we are really trying to integrate all of the bodies of work or approaches that we're utilizing. And so we will be integrating infant and early childhood mental health as well as developmental screening, room, and also toxics education into the home-based services work. And there's great detail about what that might look like in the RFP, but quickly, I'll just note that for the infant and early childhood mental health, that we do intend to support all home visitors in securing level 1 training and endorsement for infant and early childhood mental health. For developmental screening, we are going to collaborate with programs to integrate the Ages and Stages questionnaire, or ASQ, and so that would mean that staff would participate in training to utilize the ASQ, and that the county would also be responsible for purchasing the cloud-based data system associated with that. In addition, BSK staff will be available to provide training, education, materials on room, and also toxics for home visitors. A quick review of the timeline here. Again, this is embedded directly in the RFP. The RFP was issued on September 21. We are having this information session now, but we'll also hold additional information sessions at the Burien Public Library and also the Snoqualmie Public Library. Those are on September 27th and October 3rd, respectively. The final day to ask questions will be October 27th, and the follow-up addenda posting answers to those questions will be posted on October 30. And the RFP responses will be due on November 2nd. All of this with the objective, of course, of being in contract by January 1. So just a quick note, again, that the rating criteria is detailed in the RFP itself, and that as you develop your application, you'll definitely want to be reviewing that criteria and developing your response with respect to that. It is divided into sort of 2 categories or sections. The first is community needs and resources and home visiting model fit, and the second is capacity. The great number of points, 70% of those fall into the first bucket, community needs and resources and home visiting model fit. And the things we're sort of considering or looking for under that, again, very much aligned with our ESJ framework, is how well your organization knows the needs and resources in the community for the focus population, how well they understand the model you're selecting, and how well the sort of discrete elements or core components of that model really shape or really directly impact the technical difficulty. how much the core components of the model actually are directly designed to impact the needs in specific populations or communities. Of course, the alignment of the home visiting model or home visiting program with your organization's mission, your expertise in service delivery, the extent to which your leadership has buy-in. And then finally, really your organization's expertise in serving the focus community and your demonstrated relationship and engagement with the community. The second thing it also assesses for is capacity. And here we're looking for things like training, how you recruit, how do you currently have, or how will you recruit staff that meet the requirements to serve the community, including things like cultural match, training in the model and other relevant professional development that supports staff and community, recruitment and enrollment experience and expertise, and then finally data systems. And here we do want to note that you will not be penalized in any way if your organization or home visiting program does not have a data system it's currently utilizing. What this question assesses for is whether or not you have selected one that could potentially be feasible, so you know what you need and you've done a little bit of research to show that, and that you have an interest and openness to using data. So again, all of these proposals that are submitted will be reviewed and scored by a panel of community members, subject matter experts, and King County staff. And also, you do have the right to appeal that process within 4 days, and the request for proposals outlines all the steps you can take in order to do so. So let's talk about the budget a little bit. So there are a number of requirements associated with the budget and also a number of tips or recommendations for the budget. The first under requirements is that all applicants are required to submit a budget as part of their application package. The budget will not be scored in any way and will likely be renegotiated if selected for award. But we do want to get a cursory understanding of costs for your program. We do encourage you to include evaluation costs of up to 10% in the budget. A reminder to include estimated costs to participate in BSK required trainings and other activities, so that would also include things like integration of the ASQ, as well as other activities associated with the infant early childhood mental health. And finally, a note that administrative costs should not exceed 12% of the total budget. On the tip side, just a reminder that the budget template, it's an Excel spreadsheet, is available on the RFP website, on the procurement website. If your program has a national model developer, and nearly all of them should, given that this is the evidence-based and evidence-informed RFP, we highly recommend that you consult the national model developer or the local TA provider for required and recommended costs. Don't forget to include not only your base funds, but also your startup and expansion funds. So there are 2 separate columns embedded in the RFP budget template for each of those costs. And just a quick reminder that the template itself is set up with lots of formulas and it auto-calculates. And we recommend that you really not alter those formulas, but that you also be attentive to the fact that they are in there. And the next slide is just a quick glance at what you'll see when you click on that hyperlink on the procurement website. So the first image you see at the top there, that is what your budget template will look like. And any of the red categories, those are categories that you should type in with additional detail. And in addition to that, you'll see all of the places in the budget template where you would actually enter your proposed costs and things like that. The second image you see, the one on the bottom, are the budget template instructions. And so this has a step-by-step outline for how it is that you can complete that budget template, and then also some images so you can see what that would look like once it's completed. So just a quick reminder that the budget template is on tab 1 of the Excel spreadsheet, and the budget template instructions are on tab 2 of the spreadsheet. So if you need help finding those, do let us know, but that's where that information lives. Okay, So we wanted to share with you all of the resources that are available to support proposal development. So the first thing we wanted to note is that there are 2 additional bidders conferences. So this session is currently being recorded. It will be posted online. You can view that whenever you need to. If you would like to attend either of the 2 additional bidders conferences, you're welcome to do that. Again, those are at the Burien Public Library and the Snoqualmie Library. If you have questions, you can directly email the contracts office. Chris Diabro will be the contact there, and you can see his email contact information on the screen. We also want to share with you that you will have access to technical assistance if your organization wants support with proposal development. And so again, you'll contact Chris Diabro for that resource, and he will triage you to a number of different technical assistance providers who will really support you in many different areas. So they will help you determine whether or not your application is a good fit. They will also help you edit your proposal. They'll help you craft answers that are aligned with the rating criteria. So we really do encourage you to utilize those technical assistance resources. Please note that there are time constraints associated with the technical assistance. Those are outlined in the RFP. It is about 4.5 weeks of the total RFP where technical assistance is available. And that is so that we sort of allow our technical assistance providers to wrap up technical assistance, which tends to accumulate toward the end of the process. So there is, of course, a much higher volume of requests as the deadline gets closer, and we really, encourage you to access that as soon as possible during the time period in which it's available, and also just want to remind you about the time constraints associated with that. We also want to point you to the glossary of terms for a list of relevant definitions to the particular RFP. So don't forget to check the glossary of terms in the RFP. And then finally, also just to complete that checklist, which reminds you about a few requirements associated with the request for proposal and application. And that includes things such as not utilizing font larger than Arial 11 point, not exceeding the 6-page single space 1-inch margin limit, and not forgetting to include things like your cover sheet. So not meeting those requirements will disqualify your application, so we definitely want to make sure that you have really carefully utilized all of those resources and included or met all of the checklist requirements. So that is the end of the RFP review, and now we want to take the opportunity to open up to questions. So I'm looking to the, just go ahead and read them, or we have no questions? Okay, so two quick things here. If you have any questions about the request for proposal process, please feel free to type. I'll read your question out loud. Also, so are folks unmuted if they want to ask a question? Okay, great. So also now you are unmuted. So if you also just want to shout out your question, please feel free to do so. It does look like two individuals are typing, so we'll go ahead and let them finish. Okay. So our first question is, you mentioned leadership personnel in the startup costs. Are personnel allowable who act as a supervisor within the regular budget as well, or is that restricted to admin indirect? Absolutely, it is an allowable expense to include supervisory staff, management staff. Those are all allowable expenses. So please do include them in the budget at a ratio that is in alignment with your model's recommendations. We just wanted to acknowledge that oftentimes when a new, especially an evidence-based or evidence-informed practice starts up, because those programs have so many requirements and require a lot of liaising with the national model and things like that, we wanted to make sure that we provided additional allowable leadership costs. But ongoing program management and supervision is absolutely a cost that can be included in base funds. Okay, so the next question is, thank you. Can you provide an example of community input as mentioned on page 13 of the RFP? So let's go ahead and grab page 13 of the RFP. We're getting it. Okay. Okay. So just context for people out there who may not have the RFP directly in front of them. We are in section 6 under rating criteria, and I believe that Kathleen is referring to the final section, which says the applicant demonstrates expertise in engaging and effectively serving the focus community. Is that correct? Is that correct, Kathleen? I was referring, more to the application development. Okay. Sure. So I can speak generally, and then perhaps we can follow up with a more detailed answer in the addendum. But generally, when we're talking about community input, we want to understand the ongoing engagement a community-based organization has with the focus community. And so that would mean things like when you select a particular home visiting model, that you have somehow engaged the community in understanding what they need or in providing feedback on the model itself. If you have an ongoing home visiting model that you're running, it would mean things like providing participant satisfaction conversations or debriefs, or potentially a more formal survey or something like that at the end. We just want to understand that programs have in place a regular system for engaging the recipients of services and also more broadly community members in thinking about what services a community wants and needs, and whether or not they're satisfied with and find utility and value in those services. You're welcome. Are there any other questions? looks like we have another question coming up. The question is, will TA providers also be reviewing the applications? So for the technical assistance that would be provided in terms of application development, you can request from your TA provider sort of whatever service that would be most useful to you. So if it's just that you want to run some ideas by them and help sort of develop some thinking or framing around a question, your TA provider can do that. If you give your TA provider enough lead time, they are also definitely on board for doing things like application review, and that can be for content as well as a simple copy edit or something like that. So that whole scope of services available from TA providers, I think just being clear about what it is that you're looking for with them and giving them enough lead time to support what it is that you're requesting. Oh, sorry, the clarification is I meant will they be on the review committee to score the proposals? So no, the technical assistance providers will not have any bearing on the request for proposal process whatsoever. I will quickly note that I know that many models operating in our state, particularly Parents as Teachers, Nurse Family Partnership, Parent-Child Home Program, two of those models which aren't eligible, of course, have technical assistance providers that are provided by the state and Thrive Washington. That technical assistance is completely outside of the technical assistance that we're talking about for application development. It could be that we bring in some PAT technical assistance experts in the RFP process. We haven't determined that yet. So we have a question that says, could you please speak more about the model eligibility criteria on page 7 of the RFP? So we'll go ahead and pull up the model eligibility criteria. Great. So this, again, for those of you who don't have the RFP directly in front of you, this is the evidence-based program criteria. So this is the funding category, evidence-based programs. So I suspect what we're asking about here is the model eligibility criteria. And again, there are a set of program characteristics associated with that, as well as research and evaluation. So on the program side, those include that the program has a theory of change. It also has a formal manual and also a training guide that specifies all of the activities. Typically, that includes things like fidelity measures, and that the national program developer offers training or guidance in program implementation. And then, of course, like as we said before, it has to, the program itself has to meet the home visiting definition outlined in Section 2A of the RFP. So those are the requirements on the program side. On the research and evaluation side, for the evidence-based programs, this is really that they've had 2 randomized control trials performed for that specific intervention. And I do want to note here, this is not a discrete element of an intervention. So for example, it's not just a curricula, right? It is the whole intervention, which includes things such as the staffing that is utilized, the curricula that's utilized, the components of the intervention, such as what activities happen during a home visit. So all of those constitute the intervention. So it can't be just that discrete elements of an intervention or program have been tested. We're looking for the whole shebang here. And again, it doesn't mean that these other models aren't eligible. It just means that they aren't eligible for that bucket of funds. They may live under evidence informed or the January RFP for community informed practices. So we wanted to make sure that all programs really were eligible. It's just which funding category is your model best aligned with? So the next question it's a clarifying question. These are minimum eligibility requirements? Yes, those are minimum eligibility requirements. Certainly, if the home visiting model that you're applying for has 3 RCTs, it's absolutely eligible. Are there any other questions? Okay. It looks like that is potentially the end of the questions. I thank you so much for all of the great questions. And again, this recording will be posted on the Best Starts for Kids website. And so you can access that as many times as you need. You can also access the number of resources outlined in the RFP and then also in this presentation. And we will have 2 additional bidders conferences in person this week and next for any additional questions. And of course, our contracts office is available for inquiries beyond that time period. Thank you so much for taking time to join today. And thank you to Sarah for the evaluation presentation and the comms and contracts team here. So hope you all have a wonderful day.